Finally, let's welcome Dr. Ted Parcell of Novant Health Orthopedics and Sports Medicine. Dr. Parcell, it's so good to have you back on the show.
Thanks for having me. I appreciate it.
That's the only time I get to see you anymore during this COVID thing.
Yeah, things have changed quite a bit.
Yeah.
And hopefully soon we'll get back to where we want to be.
I hope so. Well, there may be some viewers out there, and this mask is driving me crazy. There may be some viewers out there who haven't had the opportunity to see you or learn more about you. So remind us about your education and your background.
Sure. I'm initially from Pennsylvania, but I've been working down in the Carolinas now for over 12 years. I trained in Pennsylvania and then did my hip and knee replacement fellowship down in Tampa, Florida for a year of extra training in hip and knee replacement. And then I've been here a little over a couple of years, almost a couple of years now. So.
Yeah. Well, I'm curious, what interested you in orthopedics?
Sure. It goes way back. I'm, like most kids, I was a sports fan, and when you see one of your favorite athletes go down, hurt and lost for the season, it kind of piques your interest as to the field and how they get them back on for selfish reasons at that time. You want to see your team do well, and then as it evolved, I initially thought of doing sports, but it became more clear to me that joint replacement was right for me.
Yeah, and there's a lot of it here.
Certainly is.
Tell me a little bit about your office, and I know you have a partner physician, so talk about your office.
Yes, our office is located in Supply, right on 17, just past the electric company. And in the office is myself, my partner, Dr. Ben Browning, and our PA, Devin, seeing patients there most every day of the week. A few other staff there, and we're just a stone's throw from the hospital, so if we need to run over there for any reason.
Yeah, close to the hospital for sure.
And easy to find and right on 17.
Yeah. So I know you've done special training in hips and knees, and so I want you to talk about that a little bit.
Sure. My extra training is in hip and knee replacement, from the simple, straightforward, first-time surgery, but also some of the more complex revision surgeries that people have had 2, 3, 4, or more surgeries seen, and try to get it straightened out. I'm also competent in taking care of some of the infections that we'll see around. And some of the other guys in the area have even called me on some of the fractures that happen around an implant as to fixing it.
I bet that's complicated.
It can be and can be time consuming, but I'm happy to do it if it's in the patient's best interest.
Yeah, absolutely.
And what we've also seen now is, especially over the past year, we've seen quite an influx of new residents to the county. And I've had folks who have had their joints replaced in the Northeast or elsewhere through the area come just to, hey, I haven't had it checked out in a few years. Let me know what you think, and we've seen more and more of that recently.
Typically, is it an older patient who needs a knee replacement?
Not always. That's the old rule of thumb, old wives' tale sort of thing, that joint replacements were only for elderly people with kind of a limited expectancy. The old thought was, okay, our implants are only going to last 10 or 15 years. If you look at the data that's out there, at 15 years and longer, 95% and higher are still doing well. So our implants have improved. They're not wearing out like they used to, so we can get in sooner. So people don't have to suffer and wait year after year. But we can get in and they can get back to life, and especially around here, back to the beach, back playing golf. And getting outside and being active. Yeah,
because I'd heard a long time ago, I used to hear people say, well, I don't want to get it till I absolutely have to, because it'll wear out and I'll have to get a new one.
Yeah, and it's since the implants have evolved, we don't see it as much of a problem now as even back when I was training, we saw much of it, but we don't see it as much now.
So now you get it when you need it.
The implants are better. Yes, so you can go ahead and get in. In my career, the youngest total hip I've done is in her 30s. And I've also replaced people up into their 80s and even a couple into their 90s.
Really?
Yes.
Oh, wow. So tell me about Dr. Browning. Does he have a particular focus area?
Sure. He is a sports medicine orthopedic surgeon, so he specializes in taking care of our athletes and doing the arthroscopies of knee and shoulder. And since my training is in hip and knee, I don't do much in the way of shoulder work. It works well to have us both in the same office, that he can take care of all the shoulder needs and upper extremity things that are not in my specialty. But we brought him in back in the fall, and he's picked right up. And now that sports are starting to resume, and get into the schools and take care of these athletes now.
Yeah. Yeah, it's certainly been a strange year for all of us, though.
Most definitely.
And in your office, have you seen that people have been putting off their replacements because of COVID?
Quite a bit. Before everything happened a year ago, we were seeing patients in the office and getting them ready, and a lot of them sort of vanished. And you see them coming back now. Oh, hey, I was going to, but I was scared. And now that it's becoming less of the terrifying issue that it was a year ago, that patients are starting to come back out, those that have been vaccinated, and patients are all getting tested preoperatively
That's true.
so that the appropriate precautions can be taken if necessary. And it shouldn't be scary for patients. If they need to seek care, and they should. Waiting around, hurting, and being miserable is no way to live.
Well, yeah, you're just delaying getting better now.
Right, and by now, patients could be up and at 'em now as the spring rolls in, and can be more and more active.
Yeah. Let's talk about some of the measures that your office has put into place to keep patients safe while they're in the waiting area and so on.
Yes. There's a number of things, and a lot of this is across the board for Novant facilities, that patients are all being screened on the phone before coming to the office. There's temperature screens at the office. We will limit the traffic in and out of the facility, and patients can bring with them one person, one family member, spouse, whomever, so that you don't have large families gathering around. And everything is being cleaned and wiped down between patients, including the waiting room and the door handles and the scale and everything from that sort. And the staff's all taking the appropriate precautions and with patients.
And the staff has all been vaccinated.
Yes, and everything's gone just fine.
And the hospital, too, they've taken many of those precautions, if not all of them.
Yes.
And as you said, patients are tested prior to
my
surgeries.
Joint replacement patients that go to their pre-op appointment just to have their routine labs drawn prior to surgery are also being screened for COVID.
So again, you would say, don't delay your orthopedic care. It is time to...
It's time for people to get back out and come seek the care that they need.
Okay. Yeah, because like you said, they could be better by now. They could be out playing golf or something.
Right, especially now that the weather's all starting to change over and it's getting warm out. Yeah, the golf courses are getting busier and busier. And yeah, enjoy your life. That's why I do this for a living, is to get people back to doing things they want to do instead of sitting around and being frustrated.
And hurting.
Right. I want to get people back to life and doing things.
Are both you and Dr. Browning accepting new patients at this time?
Most definitely. Most definitely. In our office, whoever answers the phone will get you in as soon as we can, and we'd be happy to see any and everyone. And
do you need a referral?
Depending on the insurance, you may, but a lot of insurances now you can call directly.
Correct. And your office could probably tell them that when they called in.
Yeah, the girls answering the phone are highly knowledgeable and can take care of those questions.
Well, that sounds great.
Yes.
Great. Do you offer video visits?
We do. We've used them sparingly, and what we do for a living, getting people in and it's difficult to get people actually in an image to get their x-rays so we can actually see what they need, and then getting an examination to really get down to the meat of it. Some of that is very difficult to do remotely.
Yeah. Okay.
But we have the capability when necessary.
Okay. That sounds great. Well, thank you again for coming today. It's been a pleasure to have you, and I look forward to talking to you soon.
Thanks. A pleasure as always. Thanks again for having me.